The information provided in this video is for educational purposes only and is not intended as medical advice. Please consult a healthcare professional for medical diagnosis and treatment. The content is based on current research and clinical guidelines, but the individual cases may vary. Hello everyone, I'm Dr. Shlok Munjal, and today we'll be discussing regarding intoxication, a condition resulting from ingestion of substances that can impair physical and mental functions. Intoxication can be caused by various substances, including alcohol, drugs, and other toxins. The core deficits of intoxication include impaired judgment, motor coordination, and cognitive issues. These deficits can lead to risky behaviors, accidents, and long-term health issues. Intoxication effects include particularly its effects to autonomic nervous system, which controls the involuntary bodily functions such as heart rate, blood pressure, digestion, and respiratory rate. Depending on the substance, intoxication can lead to a variety of autonomic dysfunctions. These include the following: sympathomimetic effects. Substances like cocaine and amphetamines stimulate the sympathetic nervous system, causing increased heart rate, tachycardia, elevated blood pressure, hypertension, sweating, diaphoresis, and pupil dilation, mydriasis. It can also cause parasympathetic effects, such as by substances which are cholinergic, such as organophosphates that stimulate the parasympathetic nervous system, leading to a decreased heart rate, bradycardia, excessive salivation, lacrimation, urination, defecation, gastrointestinal distress, and pupillary constriction, which is meiosis. Mixed effects can also happen. Substances that can cause mixed effects include alcohol, which can stimulate the sympathetic nervous system while also causing parasympathetic effects. Some of the sympathetic effects of alcohol include increased heart rate and blood pressure, but the chronic use of alcohol can cause parasympathetic domination, resulting in bradycardia, which is low heart rate, and hypertension. Autonomic dysregulation includes severe intoxication that can lead to autonomic dysregulation entirety, where the balance between the sympathetic and parasympathetic activity is disrupted. This can result in symptoms such as orthostatic hypotension, where the blood pressure drops significantly upon standing, and gastrointestinal motility issues like the paralytic ileus. Substances can also cause withdrawal effects. Withdrawals from substances like alcohol and opiates can cause significant autonomic disturbances, including tremors, sweating, tachycardia, hypertension, and gastrointestinal symptoms. Intoxication is a global issue with varying prevalences based on the substance type and region. The pathogenesis involves both genetic and non-genetic factors. Genetic predispositions can influence how individuals metabolize substances, while the environmental factors like stress and peer pressure can also play a very significant role. Evaluation of intoxication involves thorough clinical assessment, including history taking, physical examination, and laboratory tests. Identifying the substances involved is crucial for appropriate management. Some of the laboratory tests that you could do include urine toxicology, TSH, T4, LFTs, CBC, CMP, electrolyte disturbances, and others. Non-pharmacological treatments include supportive care, such as ensuring a safe environment, hydration, and monitoring vital signs. Behavioral therapies and counseling are also essential for long-term treatment. Now let's dive into the pharmacological treatments. And pharmacological treatments means medication-based treatments or some substance-based treatment. For hallucinogenic intoxication, such as with LSD or psilocybin, that is managed predominantly by supportive care. Benzodiazepines can also help with severe agitation or anxiety in context of hallucinogen use. Antipsychotics are also used cautiously due to their potential side effects. As for serotonin syndrome, which is the second kind of intoxication we're talking about, it is caused by serotonergic drugs, and it's treated by discontinuing the offending drug and providing supportive care. Benzodiazepines and beta blockers can also help with agitation. In severe cases, cyproheptadine, which is a serotonin antagonist, may be used as well. For antimuscarinic intoxication, such as by atropine or scopolamine, this is treated by physostigmine, which is a cholinesterase inhibitor, which increases acetylcholine, and it mitigates the antimuscarinic intoxication, which causes a decrease in acetylcholine. This should be very carefully monitored due to the potential side effects. NMS, which is neuroleptic malignant syndrome, is a life-threatening reaction to antipsychotic drugs, and this is managed by discontinuing the offending drug and providing supportive care. Particularly, dantrolene and bromocriptine can be used to reduce symptoms as well. As for opioid intoxication, this is treated with naloxone, which is an opioid antagonist, which can rapidly reverse the respiratory depression. Supportive care and monitoring are essential in this case as well. As for sedative hypnotic intoxication, such as benzodiazepine or barbiturates, these are managed with supportive care. Flumazenil, a benzodiazepine antagonist, is used cautiously due to the risk of seizures. Cholinergic intoxication, such as with organophosphates, is treated with atropine and prelidoxine to counteract the effects of cholinergic agents on the nervous system. Understanding intoxication and its management is crucial for healthcare professionals. However, it's extremely important for the viewers that they should always seek professional medical advice for diagnosis and treatment. Overall, thank you for watching, and don't forget to like, share, and subscribe for more medical insights.